Whenever we go to a patient for daily rounds, a stroke patient for daily rounds, certain points are to be taken care of. And these are certain things which we see in a patient who is admitted to a facility. The first thing is nutrition. It has been seen that most of the times people who are on a rice tube feed, they don't get adequate nutrition or adequate amount of kilocalories because either the intake is restricted or the formula feeds are not so concentrated in energy that people can get an adequate nutrition. Again, people who might have superimposed infection are in a catabolic state. So their energy requirement is more than a normal person. So generally we try to give around 30 kilocalories to 40 kilocalories per kg body weight to a patient. The protein content is around 1 to 1.25 gram per kg body weight. Nutritional assessment can be done by regular checking of weight of the patient, measuring the arm circumference, and measuring the serum albumin level. Nutrition is also very important when we speak of healing of pressure sores, because we have seen that poor hemoglobin and poor albumin content in the blood leads to delayed bed sore healing. Then there is hydration. Patients who are on catheter should always receive adequate hydration, because a low fluid or water intake will lead to increased chances of UTI. Also, we have seen certain patients who are cardiac patient and who had a stroke. In those kind of patients, the total volume intake has to be balanced with the total output in a day. Then there is electrolyte imbalance. A lot of patients of stroke have a sodium imbalance, and we have seen hyponatremia or low sodium in most of the patients. That is sometimes because of a condition called SIADH. And when the sodium concentration in our blood goes down, we have seen that patient might have all sort of issues like becoming more drowsy, becoming less responsive, and may sometimes slip into coma. So regular monitoring of the electrolytes is very important for patients who had a stroke. Then comes the oral and perineal hygiene. Oral hygiene is very important because what we have seen is that patients whose swallow is impaired or who don't have a very good protective reflexes, they tend to aspirate the oral secretions, and a poor oral hygiene can lead to severe aspiration pneumonia. So oral hygiene has to be maintained. Again, a perineal hygiene is important because as we spoke earlier, good perineal hygiene is important for the prevention of bed sores. It's important for the prevention of UTIs. Then we have stress ulcers. Stress ulcer is a condition which is seen in patients who are passing through any acute phase. And the chances of stress ulcers increases in patients who had stroke. So we should make sure that the patients are receiving proton pump inhibitors or antacid. A lot of patients who have an ischemic stroke, they do receive ecosprin and clopidogrel, which are antiplatelet medications. That again increases the risk of having ulcers. Then we get patients who are on tracheostomy post-stroke, and tracheostomy care is a very important part of patient care, because we have seen that patients who had tracheostomy, they are very prone to getting hospital-acquired infection, and a lot of these infections are multi-drug resistant. So proper tracheostomy care by a respiratory therapist is very important, wherein regular suctioning, regular toileting of the lungs is required, regular change of the tracheostomy tube is required. And when conditions are favorable, the patients can be decannulated or the tracheostomy tube can be taken out. Then we have PEG care. Patients who are not able to swallow for a long time, they can't be put on a rice tube because there can be a lot of issues with prolonged rice tube insertion like sinusitis, aspiration. So patients who are predicted to have a long-term RT feeds or rice tube feeds, they are advised to go for a PEG tube. Now, PEG tube is the benefits of PEG tube is it's a wider tube. There are minimal risk factors, and more nutrition can be given to a patient through a PEG tube. Then there is positioning of the limbs. So again, as we spoke earlier, that spasticity, contractures, and deformities can be seen in any patients who is on bed for a long time or who had a stroke or traumatic brain injury. So proper positioning of the limbs, first to reduce the chances of deformities and contractures. Second, to reduce the spasticity. Third, to stretch, shorten the lengthened or the weak muscles is very important. Sometimes patients who have stroke might have pain in the shoulder and subluxation of the affected shoulder. So for those patients, positioning of the limbs or the shoulder in a proper manner is required to prevent further subluxation. Then comes bladder and bowel care. Now, bladder care is very important because patients who are incontinent or who have a retention of urine, they are generally put on a catheter, indwelling catheter, and again the chances of infections are increased. So generally what we do is, once we see that the patient is good enough, we try to remove the catheter from the patients, and we generally do a ultrasonography KUB region to see the post-voidal residual volume. If the patient doesn't have significant post-voidal residual volume, and the patient is good to inform the people that he wants to pass the urine, or he can ask the attendant to get a urine can. For those patients, we can remove the catheter, but for those patients who have incontinence, we can always use a diaper for females or a male external catheter for the males. Then bowel care. A lot of patients who are bedridden will have constipation first because they are not non-ambulatory. Generally, when we walk or stand, gravity helps us in proper evacuation of our bowel. But patients who are on bed, who are receiving formula feeds, they sometimes complain of constipation. Again, sometimes these formula feeds are not good for the patients and they complain of diarrhea. So proper bowel care is very important. Generally, what we do is we don't allow the patient to remain constipated for more than a day or two. So most of the patients do receive some laxatives, but the problem with laxatives are after a few days they stop working. We have also seen patients who had constipation and who had impacted stool, which can lead to severe abdominal pain, abdominal distension, vomiting. So any patient who is constipated, who has not passed motion in the last 3-4 days, and we see that oral laxatives are not helping, a rectal examination has to be done to make sure that there is no impacted stool, which should be removed, and enema is used. Then sleep. Insomnia or altered sleep cycle is common in stroke patients. So there is so to improve the sleep, we do something. There is something called sleep hygiene that needs to be followed. And sometimes people who have stroke respond to melatonin, artificial melatonin. So we give them artificial melatonin in night. And what we have seen is that once they go into a regular schedule of therapies and all, their sleep cycle improves. Then there is skin care. Skin care is very important. Again, we have to look for any signs of any redness, any blister, any bed sores on the body of the patient. And if we notice anything, we have to take preventive measures as soon as possible. Then there is the regular blood sugar maintenance. A lot of stroke patients are diabetic, and it's important for us to have a good control over blood sugars. Both hypoglycemia and hyperglycemia are not good for the patients. And generally, we say that any episode of severe hypoglycemia can worsen the condition. So blood sugar should be properly controlled. So these are the things that we generally see in all the patients regularly when we go for morning rounds.